Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is for our clinical team who is orchestrating all of our public flu clinics in the community. Our first clinic is this afternoon at the Carnes Senior Center from 3 p.m. to 6 p.m. Anyone is welcome to come get their flu vaccine. Both flu mist and the flu shot will be available. Vaccine will be available for those who are insured and uninsured and will be at no cost to the individual. If you have your insurance, please bring your insurance card with you though. All of our public flu clinics won't be taking appointments, and all COVID-19 safety measures and precautions will be taken and in place. So please bring your family and get your flu vaccine out of the way for this year. Additionally, we are grateful to our Parents as Teachers program, who is launching their 4th annual Roll and Read event tomorrow. This event promotes early literacy and family well-being. This year, the event will be virtual, so keep your eye on our social media pages for videos of community partners reading their favorite books in their favorite places around Knoxville. Our real-life example of putting the 5 core actions into play is going to a pumpkin patch or a corn maze. These activities are traditions for many families in the fall, and you can carry on the tradition this year with an extra focus on being safe. The great news about pumpkin patches or corn maze is they're typically all outdoors, which makes it easier for you to maintain physical distancing from those who aren't in your household. But bring your mask just in case you have to wait in a line where you can't be at least 6 feet away from others or in other crowded situations. Remind your children to wash their hands after touching any of the pumpkins or the other commonly touched items. And you can model this good behavior for your kids by washing your hands too. And as always, if you aren't feeling well or if you have been exposed to COVID-19, reschedule the activity for a later date. Those are just a few ways that you can enjoy the fall season and live your life while making sure you and the ones around you are staying healthy. Now we'll move into the local situation. We have 75 new confirmed cases since yesterday's report, giving us 9,960 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 435 probable cases. 9,355 of our cases are considered inactive, giving us 956 active cases. 374 individuals have been hospitalized at some point in their illness, and 35 Knox County residents are currently hospitalized. Unfortunately, we have no additional deaths to report, keeping our total at 84. Last night at the Board of Health meeting, I spoke about some changes to our active and inactive case counts, and I'll spend a few minutes talking about those changes here today as well. I want to start by saying that this can be relatively complicated, so I'll do my best to break it down. First and foremost, I want to stress that our total confirmed case count has not changed, and the new cases we report each day are accurate. Those numbers remain consistent and reflect the true burden of illness in Knox County. Regarding the active and inactive counts, you'll notice that these numbers experienced a moderate shift from yesterday. The inactive cases increased, and our active cases are now below 1,000. That is very encouraging, but we want to explain why that happened. The data set that we pull our data from was getting its information from active and inactive cases from the state's geocoded data, which is basically based on their address, permanent address, not local jurisdictional data. Basically, what that means is the state's data was only assigning jurisdiction based on what the cases provided as their permanent mailing address. Again, just want to make that very clear. This data leaves out the folks who are currently living in Knox County, but have a home address in another county or state and have been assigned to our jurisdiction for the case investigation and follow-up. The biggest example of this would be college students living in Knoxville. Even though their permanent address may be elsewhere, these individuals are currently living in Knox County, they're isolating here, and it is our team who is conducting the case investigations. Because of that, they are part of the true burden of disease here in our community. As of today, all cases are appropriately categorized as active and inactive, and are calculated from numbers reported by Knox County Health Department using our jurisdictional data as it's assigned in the same reporting system, thus reflecting a more accurate picture of the burden of disease in our community. We know this is confusing, but the bottom line is our confirmed case numbers are accurate and haven't changed. Additionally, as we recognize better ways to reflect our data, we will evolve and make adjustments to ensure we continue to most accurately represent the local situation. This was an example of that constant data review and evaluation. Of note, normally when data is produced, there is a lag between collecting the data and reporting it. Producing real-time data at this level that we've been doing during the pandemic is not typical, and it lends itself more towards having to make adjustments like these as more information is gathered and learned. And now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no to 3 day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or getting worse? And if so, how much better or worse, and at what rate? As a reminder, all of this data that we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. In the last 14 days, we've only seen one yellow flag. We have received an average of 77.9 cases over the past 7 days and an average of 87.8 cases over the past 14 days. So case numbers appear to be heading in the right direction. Because of this, we are representing this benchmark as green. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the test conducted for Knox County residents and another for average time between specimen collection and lab report data. Over the 14-day evaluation period, one red flag was noted for lab turnaround time. However, since mid-August, the lag time has decreased and the turnaround time is consistently around 2.5 days. Regarding testing, we did have 5 red flags and 1 yellow flag, with the red flags generally occurring on weekends when testing is not as widely available in the community. Since August 1st, the number of tests conducted has continued to decrease, but the average testing volume has remained above 4,000 a week. Because of those factors, we are continuing to represent this benchmark as yellow. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. We've added a few new team members into our EPI support team from last week. With this team, we continue to be able to initiate investigations in the desired time frame, and because of this, our benchmark continues to be represented as green. We continue to evaluate this benchmark and make appropriate changes as the situation evolves. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and patients with pending test results in the hospital. These data are gathered from the information that hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS, and it may reflect Knox County, the East Region, or patients from other jurisdictions. During this time frame, we saw 1 yellow flag followed by 3 consecutive red flags for hospitalized COVID patients. Additionally, we saw 1 yellow flag for ICU patients and 4 red flags for ventilated patients, but they were not on consecutive days. After speaking with our hospital partners, they stated their benchmark should be represented as yellow. The hospital systems continue to meet regularly, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we used the graph that shows the reported deaths of Knox County residents by date of death. Over the past 2 weeks, we have seen 11 deaths, with 5 in the last 7 days. This information available continues to lead us to represent this benchmark as yellow. And also, yesterday, we added 2 new charts to our website. They are listed under supplemental data. The first chart shows new COVID daily cases per 100,000 population. On this graph, we also show the 7-day and 14-day trend line. As of yesterday, we were at 12 cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received directly from the Tennessee Department of Health. Our daily positivity rate as of Sunday, which was the last date we had it for when we built the graph, was 6.92%. We also depict a 7-day trend line on this graph as well. Both of these charts will be updated weekly on Wednesdays, and I'll now open it up for questions.
All right. Let's turn it over. Okay. Let's see, a couple questions it looks like regarding the topic Charity spoke about the active, inactive. So if you have any further questions, I think she answered these questions in her talking points, but if you have any further questions, please go ahead and type those in. The first question we have is from Kay Bridge. If you can type your name in, Kay Bridge, that'd be helpful. From WBIR. Any advice/warnings for fans attending the Vols game at Neyland this weekend, and any advice/warnings for fans hosting watch parties at home?
Both of them are going to revolve around trying your best to really follow the 5 core actions in whatever environment you're in, whether you're at the game or you're hosting a watch party at home. Try to make sure you're able to socially distance. So keep that 6 foot between people that aren't in your household and you and your household members. So keep that distance between you. Wear a mask, wash your hands frequently. If you're hosting at home, make sure you're cleaning and disinfecting commonly touched surfaces. I think when we talked about this last week, or maybe even earlier this week, I can't remember now, we talked about the remote control. You can, and then obviously don't go if you're sick or you've been exposed. The other thing is, and we've already talked about wearing a mask, but making sure you're doing that in both settings, especially when you cannot socially distance yourselves. Lots of advice there, but just make sure that you frame your day around those 5 core actions, but then go, have fun and enjoy the game.
From David with WVLT, with today being October 1st, what is the health department advising families? You can be more specific.
That would be helpful.
Specifically, what you're talking about in terms of what we're advising.
Maybe for the fall, but we'll wait and see what he says for clarification.
Let's see. Also from David with WVLT, 44% of all Knox County deaths occurred in September. Is this number slowing with more treatments at local hospitals?
I hope that's the case. We know that deaths are a lagging indicator of what's going on in the community. And so July and August were pretty rough as far as cases, and we have seen a downward trend as of late, and we hope to continue to see that. So I think combined with hopefully less spread within the community, and also with, again, treatments and the work they do in the hospitals, and having more time to know what's effective for really critically ill patients will make a difference. And so hopefully we continue to see an improving trend on this.
From Jeff with WATE, anytime changes are made to data methodology, some in the public see it as evidence that this pandemic is a hoax or overblown. Can you offer some reassurance that this change is a better/good way or was done in the interest of accuracy?
Yeah, and I want to start off with the number of our cases hasn't changed. This was really about the reporting of whether we're still in isolation or not. And this is real-time data being done in a way that's really, truly unprecedented, and that we are presenting. Public health data, I've been in public health for over 20 years, and we have never presented data in this way. And so we are committed to being transparent and being open. And so we want to present the most accurate data we have. And so when we found a discrepancy, we looked into it, and we We corrected it and we're reporting it here. This is not, again, the normal way that we do things. Normally data lags at least a quarter. For most of our public health data, it's a year or more. And so doing real-time, everyday updates is challenging, and we just want to be as transparent as possible. But I'm going to go back to the point of our case counts have not changed, and those are accurate and they reflect the burden of disease in the community. What we looked at was we were just missing a sample of people, a small group of people that had not gotten pulled into our inactive case definition, meaning that they were out of their isolation period. That's as simple as it is, but it doesn't change the actual burden, overall burden of the disease that our community has been facing throughout this pandemic.
From Alan with Inside of Knoxville, the explanation for shifts, people who live here rather than have permanent addresses here, would increase the number of active cases, it seems to me. How did they drop dramatically and who was taken out?
Nope, actually I thought the same thing, but when they went through the formula for me, it made sense. And so what we looked at before was we were taking our total case count and we were removing the TDH inactive cases. And those again are based on permanent address, the geocoded data that the state's using. They're doing amazing things with across the state. But what it wasn't considering was those cases that were, like we said, living in Knox County but had a different address. Many of those cases had been pulled out. They had met their 10-day isolation period, but they weren't being pulled into that formula data set. And so now, so our previous formula was total cases minus the TDH inactive cases minus our deaths equaled the active cases. And now it's the total cases minus our jurisdictional inactive cases minus the deaths equal our active cases. And so it has the full picture. And if you think about time frame of when we had our large spike of our university population, a lot of those should have rolled out by now. And so looking into that and taking a deeper dive was where we realized there was a switch in the code that we needed to use to pull the data more accurately.
From Vincent with the Sentinel, where did those 600 people get transferred to? And does this change account for people without addresses?
No, this is not, they didn't transfer them out of ours. That's what I'm saying. So our case count remains the same. Our active cases from what we've been reporting remain the same. We had not, our confirmed cases, we had not, they weren't being counted when we were just doing our simple math to get the active number. Those, 600 cases or so were not being counted in that math to begin with. And so they haven't been transferred out. They're still in our jurisdiction. Some of them in the state data is not showing in the state's confirmed case count numbers because they're using the geocoded data. And we are working through that with the state as we speak on making sure that we get to the same place with our data, because the jurisdictional data is very important, and that's what we've been going with, because again, this is the burden of disease here in our community. And it's the cases we're working, it's the people that are here isolating here and have been exposed here typically and have maybe exposed others here in this community.
From Brian Harmbach, it's early, however, what is the thought about neighborhood trick-or-treating on 10/31?
We're very excited. Actually, I think our communications team just met about this and are going to be putting out some ideas and some recommendations on our website and social media very soon, looking at CDC guidance and other guidance from subject matter experts across the country. And I think they have some creative things coming, and I don't have the full picture, but I'm excited to hear what they come up with, but it'll be coming out very, very soon.
Similar question from David with WVLT. We are having families reach out about Halloween. What is the health department's advice other than the 5 core actions?
And that's really, I think you're going to see the advice that we're going to put out is how we can implement the 5 core actions while still having the opportunity for our kids to celebrate and enjoy Halloween, just maybe in a different way than what they had done in the past. And so they're going to revolve around the 5 core actions because, again, that's our mitigation strategy. That's what helps prevent the transmission of the disease in the community. So again, I promise more stuff is going to come very, very soon. They're working on that as we speak.
From Vincent with the Sentinel, did the recode transfer people who have a permanent address in Knox County but are being treated within the Knoxville metro area or Knoxville Hospital District?
No. So again, we have not transferred anyone out of our jurisdiction from our confirmed case data. All it did was switch. We were missing some people when we were pulling in an active number from that jurisdiction. So the confirmed cases have been staying, and those are ones that are living in Knox County. If they're in the hospital, then yes, they're counted, but that's only if they're still living in Knox County. If you've come in from Union County and you visit a Knox County hospital and then you go back home to Union County, that doesn't get pulled into our jurisdiction. If that's what you're asking, I'm making sure I'm tracking your question correctly.
I think that is, he says, he just commented, apologies, that earlier question was asked before Jim answered the
thank you.
From Jeff with WATE, do I understand this correctly? The overall cumulative case number comes from KCHD. The active inactive number comes from the state. Thus, the active inactive cases were not going down as they should have because they were being subtracted out of other counties, right?
That's essentially very good summary. Thank you. So that's been fixed now. But so now we are changing, we changed the code. Again, it was pulling from a different piece of the ginormous, for lack of using a proper word, I can't, it's a huge data set. So we're just pulling from our jurisdictional data for that instead of the geocoded data piece. So you're exactly spot on correct. And I just said ginormous on TV. Sorry about that.
From Vincent with the Sentinel, the fourth benchmark shows a moderate decline from the 28th to the 29th. Has that decline continued, or is that a blip?
Fourth benchmark being hospitalizations. Actually, we are actually seeing a continued slight increase in hospitalizations. I'm glad you brought that up, something I wanted to address today, because it is concerning. So it's been about a week that we've been seeing an upward trend. There was a little bit of a dip, but the trend overall is moving up. We think this can be two things. So one thing that it could be potentially is it could be that things are moving in the right direction and we're having decreased cases. And those are, as we've talked about before, hospitalizations, there's a lag there. And we're still seeing the hospitalizations from when we had our spikes a few weeks ago. But that hopefully that will go down and we'll start seeing hospitalizations go back down and over the near future as our case counts go down, which is a really good thing. And that's where we hope that we end up. The other way this could go, and we're just wanting to put this out here for everybody, is that we've also been talking a lot about how we're concerned about the decrease in testing we're seeing. And we talked about this early on, whether or not you get tested, if you're going to end up needing to be in the hospital from this disease, that's not going to change whether you got a test early on the front end or not. And so hospitalizations in a lot of ways is the really true metric to look at that burden of disease and severity of disease within the community. And so there is a little bit of a concern in the back of my brain that this could be a reflection of the lack of testing, but people are still seeking care when they need it at the hospitals, as they should, and we want them to continue to do. But we worry about that. So if the trend continues to go up, that would be more worrisome. So we are keeping a very, very close eye right now on where that is and where it's going. It's only been about a week, so it's really hard to make a judgment call, but those are kind of the two scenarios we see playing forward. And we truly hope, and we hope that it's going to go in the direction of those hospitalizations are going to come back down.
All right, any other questions? Please go ahead and submit them now. All right, Vincent says he is typing.
Okay.
We'll give him 1 second.
Please don't make me do public math, Vincent.
So from Vincent with the Sentinel, can you clarify what the purpose of the supplemental data is?
That is actually data that we had been asked to provide during Board of Health meetings and from some of our community leaders to help give another view of what's happening within the community. White House Task Force and other folks are really relying heavily on the positivity rate. And we've been looking at it in the background and talked about what we are concerned about with the limitations of that data, but the trends are still there and can absolutely be looked at and considered when making decisions and other things that need to go with the overall community response. And then the same thing for the rate per 100,000. That goes in line with the White House Task Force reports, and a lot of the recommendations come based on that. And so we have been asked by some community leaders to add that to our website so they could keep an eye on that and the trend with that as well. So hopefully additional information is good for you and the public and our leaders and can continue to move forward. And as we find where we can add it, we will, with limitations, obviously, with what we have access to and our time to do those things.
All right, any other questions? Please go ahead and type them in now. All right, not seeing any other questions come in, so thank you all. Oh, Vincent says 1 second.
This is long. I got excited. I thought something just popped in then.
I know, I'm trying to refresh just to make sure I'm not missing it. So. Okay, from Vincent with the Sentinel. Last night, your EPIs talked about recession barriers or escalation barriers. Can you explain what those are?
Again, this was a request from many community members for the Board of Health to be able to look at adding some metrics to help make decisions on when to start removing some of the policy recommendations or regulations that have been set forth by the Board of Health. So looking at the mask requirements, the curfew, and the limitations on crowd size. And so the good folks at UT got started with that at the previous Board of Health meeting, and then spoke with our EPI team who started running with that, looking at a lot of information that's out there. There's not really a set standard for what this looks like right now. So trying to compile all the different ways that they could find that folks were looking at how and when is the safest time to start removing restrictions and getting back to a different way than what we have been doing things over the past 6 months. And so that's what that is. Still up for discussion. Again, as I mentioned last night, our leadership here hasn't even been able to see it since she's not here this week. And so we just wanted to put it out there for the board to be able to start considering those measures. I don't know that we'll end up with those exactly the way they are. There's a lot of room for discussion. We went with kind of what the standards were in areas from the White House Task Force and World Health Organization and other groups that are working on similar things as best we could, but obviously need to consider our local community situation. I think Dr. Shamia put it well, what's tolerable in the community and what works for our community. There may need to be some adjustments there. So there'll be some discussions moving forward on what those end up being, but the request was from the community overall and from the Board of Health to do that.
And Vincent's 2 follow-up questions were, who did you work with at UT? And is the goal here to provide a more structured response to the pandemic?
The team we worked with are the data analysts at UT that have been helping them with their data moving forward in the past. You know, this is not, it's the responsibility of the Board of Health on how they use those, but I want to make sure that everyone knows that our response here doesn't change. These are really specifically for the community-wide regulations that have been set forth by the Board of Health and when to roll those back. But our response here will stay the same for Knox County Health Department. All the stuff that we've been doing, we will continue to do. So it doesn't really change that end of things.
All right, I'm not seeing any other questions that have come in, and it's right at 1 o'clock. So thank you all for your time today, and we will chat with you again at 12:30 on Tuesday. Have a good rest of your day.